The CDC is warning all of us of a drug-resistant and deadly fungus that has been spreading rapidly across the nation's healthcare facilities.
But how is it impacting us here in Colorado? Caroline Peters joins us live in studio with more on what we all need to know about this, Caroline.
Yes, good morning. The deadly strain of fungus, it's known as C. auris, and the reason the CDC is telling us about this fungus spreading rapidly is the amount that it's spread recently. Now, it's been around since 2016, but the number of reported infections caused by this fungus, that has recently tripled. So look at the map here. You can see there's only one case in Colorado. There's 160 cases in Texas, and Nevada has 384. You can see it's working its way in. So I spoke with an infectious disease expert here in Colorado to see what our state is doing to be proactive in the case that this fungus spreads next in our state. And I'm told most people shouldn't be too worried. C. auris is mostly a threat to those who are vulnerable in healthcare facilities, often already sick people who are on a ventilator.
Really, the people that are probably the highest risk are those that are, again, in the hospital, having procedures in long-term care facilities, those that have chronic ports or IVs that they need for medications. That puts you at a slightly higher risk than the average individual.
And unlike other fungi, this strain has grown resistant to drugs out there that treat infections caused by yeast. I'm told this is common behavior for bacteria, but not fungi. The symptoms for those who are fighting off C. auris are fever, chills, sometimes an unstable blood pressure. So while this is only being seen in hospitals, I'm told if something were to change, if it were to become more common in the community, the best thing to do, wash your hands, clean surfaces.